we are ready to go.
Thank you.
Yes. All right, Claire. Well, I will hand it over to you for this, our third session of our conference. This is not a CE session, so you don't have to worry about a link afterward. But Claire and our guests have a really, really incredible topic to talk about: eating disorders in underserved populations, and I really can't wait to hear their incredible insights. So, Claire, I'll hand it over to you.
Thanks, Kirsten. And I also just want to say a special thanks to Eating Disorders Hope for providing a platform for this really important discussion. So looking forward to an engaging presentation, hearing from our wonderful panelists, and also hopefully some questions and discussion from attendees. So I don't want to take too much time because I want to leave plenty of time for our panelists to share their experiences, but I did just want to, by way of an introduction, talk a little bit about the National Eating Disorders Association's commitment to bringing attention to eating disorders and how they affect all people. You know, we often in this work and in our organization run up against myths. You know, there's still, unfortunately, so many myths and misconceptions about who struggles, and we really need to address that, and we need to talk about how these illnesses affect populations that have not been part of the conversation. And so this is a great opportunity to bring attention to the need for more sensitivity among eating disorders providers. You know, how do we overcome barriers to treatment, particularly for African Americans who are in need of support? And in this presentation specifically, we're going to focus on challenges that the African American community faces when in need of eating disorders treatment. We have two fabulous panelists and experts, you know, from both a clinical perspective and a personal perspective. So I want to start off with you, Dr. Mazella, and just hear a little bit about your background, how you came to this work, and then we could talk a little bit more about barriers to care. So can you share a bit about how you came to this eating disorders work and your experience?
Sure. First of all, I want to thank you all for inviting me to be part of this wonderful panel, and I would also like to extend gratitude to the panelists as well. I started with this work with excitement, and I still have excitement today doing the work, and I started it in 1997 as part of strategic goals to support women and leadership, women with all of the challenges to flourish and thrive in a college setting, because there were certain goals I needed to meet or skills that I needed to have to be able to work with women who are highly ambitious, bold and intelligent, and coming against structures that may not always support that type of leadership. So that's when I entered, and I started seeing clients in my clinical practice struggle with perfectionism, loss of agency, you know, competition, criticism, you just kind of all of those things that would sort of sometimes have an impact on women's development. So then that's when I started the journey working with women and eating issues.
That's great. Thank you, Dr. Mazella. And Karla, I'd love to hear from you. You know, we talked, I started talking about some of these misconceptions around eating disorders and who struggles with eating disorders. You know, how did this affect you personally in your journey, and how did it affect your decision to seek help?
Yeah, I think that it's interesting. You know, I think I was pretty lucky to be open to the possibility of recovery once I had a name for what I was going through. But what I noticed is that I was alone, you know, that I was often the only brown face in the room, or that people would come in and leave quickly because they didn't feel like they could relate to, you know, other people who are in recovery. And so with a disease that is already isolating and, you know, giving for many people who suffer from it the information that we're alone, that we're unique, that, you know, no one else feels the way that we do, to enter a recovery setting hoping to find common ground, and often being met with you know, with feeling more alienated alienated, or, you know, having the idea that you're alone be somehow corroborated by being the only brown face in the room, or having no practitioners who look like you or have at least experience or knowledge of what your cultural experience might be, that I think that can certainly be a barrier to wanting to continue recovery.
Thank you for that. And Dr. Mazella, I'd love for you to chime in here too from a clinical perspective. You know, what other barriers exist that you've seen in your practice and in your work that prevent Black women and men from reaching out for help and accessing care?
I would support what Karla is saying, because a lot of when I work with, and that's one reason I went into the practice as well. In 1997, it was very, very slim pickings, if you will, in terms of providers of color. And so, and I get, you know, Black, and specifically Black women that I meet and work with will say they will not enter or do not want to come into therapy because of just, and not that they don't feel that people are competent and caring, because I think we all enter this profession to help people of all races and creed, but there are complications and nuances with Black women, because historically in this country, we really do have to be competent and deal with implicit bias and cultural competence around the isms that Black women bring unique circumstances around just having to deal with the historical impact on Blacks in America. And I'm talking, and even if I'm working with women around the diaspora, but the United States, Blacks in the United States, because of slavery, because of all the oppressive forces, it's a little unique, and the cultural nuances around food, whether that's size, shape, food insecurity, food desert, wealth, you know, in enclaves that are basically mostly the dominant culture, and having to navigate a boarding school or a suburbia school and being the only person, Black woman. So there's all of that. It's really complicated, but those are a lot of the clinical issues I work with.
And does that, Karla, in your experience, does that resonate with you as far as some of those unique stressors and experiences?
Yeah, definitely. And then I would even say within, as Dr. Fuller was saying, that like within our own community, there are a whole other host of issues, you know, whether it's skin color, or, you know, which certainly dealing with an eating disorder, you know, it's often like looking at the outside in, value from the outside in, you know, and so if there are kind of internal discomfort around, you know, feeling alone because of having a different skin color, like having darker skin or lighter skin, or different socioeconomic background within the Black community, or, you know, then I think that those can also be things that allow for further isolation.
Mm-hmm. Dr. Fuller, you mentioned that when you got into this field, and I think this is still, you know, a persistent issue that, and what I would like to talk a little bit more about the fact that there is, you know, a lack of, or we need to encourage more people of color to enter the field and get trained. And, you know, how important is that, and how can we help to encourage that? What have you seen in terms of strategies, and how do you feel that this can be accomplished?
Well, I think, and I'm excited about the opportunities. And I want to just share an example with myself and my esteemed colleague who I think you've met, Dr. Charlene Small, who is at the University of Richmond. We are both certified eating disorder specialists. We're writing a book which is coming out on Black women and eating disorders, which will be released in the spring of 2019, or fall. But to back up a bit, we are also co-chairs of African American eating disorder professionals for IADAP. IADAP has given us quite a platform to develop and mentor young Black eating disorder professionals. So I would charge, send that charge out to, Beta, NETA, and whether, inpatient, outpatient centers to create a pipeline for providers of color and specifically Black providers. And we right now are, since Charlene, we started this organization, this committee 3 years ago, and we are proud to say under our tutelage and just kind of mentorship, we have supported 4 new Black providers into the field of eating disorders, and they are also getting their certification as well. So that's one way, but there's many ways. Just have the conversation, invite someone different from yourself, talk to clients and assess. I mean, it's research. We're all skilled to do this, and just kind of have the conversation. We don't know. We just have to get help from each other. So just how do we want to? We're doing that small things, but it can be built upon many ways of community engagement and involvement.
I think it's interesting too, the idea of moving in small doses. I think in just like with the way that we approach recovery, it's tackling one thing at a time. And so it can seem really daunting to completely change the face of the way that we've been dealing with recovery for, inclusivity and all of that. But I think that four new people will then lead to 4 more people and 16, and so then just having people in the room having these conversations and taking active steps, small ones, every day, every quarter, every year. And, as we discussed in prep for this call, really being accountable, holding ourselves accountable for these small steps eventually will lead to big change.
I also want to talk a bit about, and you alluded to this earlier, Dr. Fuller, and when you were talking about some of the stressors and the historical components. And when we were talking in our initial conversation and kind of putting together the outline for this, the term microaggressions came up and the link to trauma. And I'm wondering if, actually for both of you to expand on that and what that means in the context of this conversation and talking about, having sensitivity and looking at some of those unique issues that come up. So I'll start with you, Dr. Fuller, if you want to, begin to explore this issue of microaggressions. And Karla, I know you have a lot to say on this as well. So,
and I'm at Duke University, right? Brilliant students, all brilliant students. Everybody is smart, just not one, population or one race. Everybody is bright. And so when we talk about microaggressions, first of all, students will say to me, well, you know what, Dr. Fuller, let's talk about, before we even get to implicit bias and all of that, let's talk about the 1,000 slights before we even get a microaggression towards us, right? So, and students are quite sophisticated. You don't have people that look like them sitting at the table. You have not invited conversation or go out to see what they might need. So there's already the slight there. So then they walk in, so if you're talking about a department chair, or, because I want to put it in the context where I work, but I also have a private, kind of practice too, where I see professionals, and they talk about management not being promoted, not being, these things add up. So students will say, okay, there's no one that look like me. I'm the only one in the department getting my PhD in like bio something STEM. And then I go in and I raise my hand, I offer contributions, and it's competitive anyway, so you want to make sure, is this a slight, is it a microaggression, or people overwhelm or whatever. But after a while, when they start to, it's a pattern and things, and then you chat with someone else in another random department and it's the same kind of patterns, then people are, they're clear that it's a microaggression. And so, and I myself as a professional, there are 1,000 slights every day. Some I know that people are just not intentional, But I just encourage all of us, if we want to be accountable and ethical in our practice and in our hearts, right? Humans, not about how I look in my professional space with my colleagues, but what's in my heart and how am I a human being and want to not impact and do any further injury to clients. That I encourage cultural competency training, implicit bias. The bottom line, we all, including myself, we have to do our own work. We just have to do our own work.
Yeah, it's interesting in thinking about microaggressions, and I'm listening, and it's like there are two, I mean, there are several scenarios where microaggressions can come in, but two big ones that I'm thinking about as we discuss this particular topic, which is in the training and hiring of people of color to be clinicians, and then also in the treatment. And so, certainly there are microaggressions that exist in encouraging people to study, and then as they're going through their training between professor and clinician and potential clinician. But then also in as Dr. Fuller was saying, without proper interest and an open space to discuss these things and acknowledgement of whether it's difference in cultural backgrounds between the clinician and the person who is receiving treatment, that there needs to be space and acknowledgement that is part of the conversation, so that if someone feels a microaggression or is wondering if, for me, it took me a long time to even realize that certain things that were happening were microaggressions, or to, if a clinician is trained in being able to explain what those things are and acknowledging that they might, without knowing, even be committing, that act, then it opens up the possibility of teasing that apart, exploring it, talking about it. And I think that for the person receiving treatment, it might open up things within the room, within their treatment, and then within the world that can help them to reconcile things that might be triggering them from a societal place that they may have interpreted. I can speak for myself. There's things that were happening on a societal level that were out of my control, or coming from outside, that I, because of the way that my eating disorder worked, took personally. I thought that was something that I was doing wrong. And now, later in life, I realized, that person wasn't, not asking me out, flirting with me during math class, and then, kind of rejecting me outside because of my skin color, not because I was too fat,
Mm-hmm.
I want to switch gears slightly, of course, still on the same topic, but thinking about our field, the eating disorders field, and research, and there's a lot more that we need to know about eating disorders generally, but I think that there are some major gaps in the research when it comes to looking at how eating disorders affect all people, particularly underserved populations. And again, this idea that the research has been so limited, and we have a ways to go there. Can you, Dr. Fuller, speak to that? Where are the gaps in the research that you see, and what do we need to be learning? How do we need to be advancing the field and challenging the field to expand our understanding of eating disorders?
Well, I think, first of all, Claire, what you're doing today, right? It has to be awareness. We have to develop platforms that people like myself and Karla and all of us who are invested in this work have an opportunity to just start talking about that and connecting with researchers, right? So sponsorship, because for us, for the Black women, I'm just going to focus on that because, I've been doing this, and I know there's a lot of research out there on, white women, and I think it's resources too, and it's availability. It's not that we cannot contribute to the research, and because it's really a dearth of it when it comes to Black women. But are we linked to establishments as a Duke or NIDA, ABITA, or any of these places where we can collaborate and join together in community and do this work? So I'm really just putting the charge out there, kind of throwing it back out there. What we have, all we need, but why aren't we doing it? Because I've been in the business since, been doing this since 1997, and I know, and I see how how the cohorts, or how people come together and write books, generate resources, develop conferences, and how people are invited and do the same. Is because, it's the bottom line. I'm familiar with you, so I know you, so we'll do it together, versus should we ask Mazella to come join us? And I have to say, because I'm at Duke and I'm pretty visible, I feel really blessed, and there's a sense of gratitude with my white colleagues who have been accountable, have invited me, have asked me to contribute, or have asked me to refer someone else, or recommend someone else. But I think we have to build upon that and do more of that.
Mm-hmm. Yeah, I came into the eating disorders field around the same time I started working for the American Anorexia Bulimia Association in 1996. And it was interesting to me that, I had this disconnect in, the outreach work that I was doing and being invited to speak to schools and students, very diverse audiences who were experiencing disordered eating and full-blown eating disorders, and being invited to speak. But then, when I looked at the materials that we had and the research, that just didn't match up with that. And so I think, we have made progress, but we still have a ways to go. And I think that we need more. We need more people at leadership seats, and coming to the table, coming to speak at conferences. But for the field to really take that seriously and understand that we all have a role in that, and that for the progress we've made, we still have a lot more work to do, and that everyone is accountable. Karla, I'd love to hear your perspective on this too, and just the research component, but also the awareness piece of it. How do we, again, talking about, we have made some steps forward, but still, when we look at mainstream media coverage of eating disorders, there is a really limited picture. And, certainly at NIDA with our campaigns and National Eating Disorders Awareness Week campaign, which you were a wonderful part of last year, Karla, and I think we've got to start expanding the stories, but I'd love to hear your take on this and your recommendations for those who are listening and for the broader field.
Yeah, I mean, I think it's just that, is like expanding the more healing and conversation and public conversation that we have, the more possibility there is that people will recover, and that it can, it will hit all different levels. It will hit, the people who are like myself, who are in front of the camera, that I can, because of conversations like this and my own recovery, I can say, no, I'm not going to do that on set, or, how about we shift the script this way, or what if I say this? There have been moments where I've received scripts and they've suggested that my character talk about herself in a certain way that I just felt was really disempowering, or could have my character is also a model on the show, and so I make sure to show her eating sometimes, small things like that, that don't even have to be loud, but are kind of subtle cues that this is a human being who models and looks like this, and also eats food, or that I don't talk about myself in a degrading way. And then likewise, the people who are in the writer's room, if there are more people in the writer's room who have awareness, if there are more people, the more people that we can get involved in this conversation, especially in advertising and media, because these images are really what, it's like we're hypnotized by a standard of beauty or a standard of being that we are encountering day in and day out, not even if we don't turn on a television. You know, I just had a daughter, and it's like, it doesn't matter if I show her a phone or not. She's got to see screens. We drive around, there are billboards. She hears other people, we interact. And so I think that the responsibility to change our way of thinking around body image as a society is not only rest within the people who are affected by it and who choose to work in this field, but also if we can make everyone aware so that we're all having the same conversation, so that fathers can, you know, watch what they say to their daughters, and so that we can, you know, certainly in the entertainment industry, have a reframing in the way that we consider the portrayal of human bodies.
Mm-hmm. Yeah, that's so important, and to think of ourselves as advocates and to advocate for that culture change. Karla, you've been very open about your own personal experience with an eating disorder, and I'm curious about what the reaction to that has been. You know, what kind of feedback have people reached out to you to open up about their experience? You know, how has that been for you in your journey to be public about it? You know, do you see that as part of your own advocacy?
Yeah, you know, I, in some ways, have hesitated to be public about it, not because of embarrassment, but because of, you know, the journey of recovery. And, you know, I'm 10 years, I had 10 years not acting out, but there were 6 years before that were up and down. And, you know, so there's always that, you know, kind of what happens if I'm doing this publicly, and then eating disorders do what eating disorders can do sometimes, which is, you know, come back, or there are all kinds of, there's like with social media in general and media, being a public person, there are positives and negatives to doing that. But it felt to me that, you know, I am in a very stable place, and I have been for a while, and that it felt important to just share and be vulnerable about where I am, what I've gone through, what I continue to go through on a daily basis. And the response has been incredibly loving. A lot of understanding and relating, and so I'm happy to do that. And, you know, and it certainly also helps me to remain human, I think, in the eyes of people, because there's something about seeing someone on screen where we want to put them on a pedestal, and I'm certainly deserve no pedestal. You know, I'm just kind of walking around the same way that everyone is. And I think it's important to know that about the people that we view on our screens every day.
That's so important. And we're so grateful to you for being willing to be vulnerable and put your experience out there. One of the things we hear so often through our helpline and you know, other areas of outreach is people don't see themselves reflected in the stories they hear about eating disorders. And I think that you being willing to share your story is so powerful and has had such a tremendous impact. So thank you for
and it helped me too. You know, I will say it's helped me to connect to people who are going through, you know, the same things or have come through it, and it reminds me that I'm not alone, and that by speaking these things, we are actually stronger. We're stronger as a unit.
Mm-hmm. That's a very important message. And again, thank you for your courage and being able to and willing to share your story. one of the things that is, a major priority for NEDA is connecting people to help. And, certainly this idea of, early intervention and being able to direct people to help, sooner, before their eating disorders become so entrenched. And Dr. Fuller, I'd like to get your perspective on this, particularly when we're talking about reaching audiences that, have traditionally been left out of the conversation around eating disorders, and, how, from, a clinical perspective, how can clinicians, be more tuned in, certainly the whole idea of being able to diagnose earlier. What are your recommendations, certainly for those who are part of today's discussion who are clinicians? What are your thoughts on that, on how we do a better job with early intervention, in reaching audiences, particularly African American audiences, where that's been a big piece of your work?
Well, I think, assessing where people are, right, on your job, in community engagement, churches, invite professionals like myself in to do, and people will come in. I mean, you can tap into your resources such as, the NEDA base, the IDEP, or all these other bases. We're willing to come in and talk about it for free and train clinicians. But I think the bottom line, Claire, is you have to do your work. You have to know what like Karla mentioned and I mentioned too, you got to think about the historical implications of Black women, and I'm only speaking Black women. And not every Black woman we're not all the same. We're very diverse, very different. But most of the people that you see come in our practice, there's some, whether it's conscious or unconscious, there's some the historical, like Karla was saying, the external environmental triggers, right? Look at us where we are now in this country around just women and the Me Too movement and just all of the political loaded impact on women, because women are, in my practice, I see with the sexual assault, with just a trigger. So I think you really kind of have to join with the person. Let the person share as clinicians who want to do early interventions, do a full assessment. Join with your client to hear their narrative, not for them to educate, especially because chances are a Black woman will see a white clinician, because that's just the way. It's not that many of us that's going to be providing that type of service. So if you want to really be ethical and really support a person in their pain and in their journey of recovery or wherever that point is, you really have to be as competent. And no one is perfect. We all know. I've been doing this work 30-some years, and I'm learning every day something different. Now with trans care, you have to always stay on top of your game. You just have to, so that you can really help the client get out of pain as quick as possible.
Mm. Yeah, and I think that's important, that willingness to always be learning, and that there are so many, certainly with eating disorders, so many co-occurring conditions and so many other aspects that connect. I mean, we talked a little bit before about trauma, and certainly your point about the cultural conversation right now around Me Too, and that's so important for our field and for our constituents.
Right. Mm-hmm.
What can you talk about, Dr. Fuller? I just got a question about the. I'm just reading it here. Hold on one second. Just want to make sure that we do repeat the name of the organizations that do provide training and mentor providers for eating disorder patients of color. Can you just mention those again for the audience?
Oh, yes, certainly. IDEP, International Eating Disorders Association, IAEDP, that's one. You can tap in there all the time. You can also, the Black Psychology, and National Association, National Association for Social Workers. I mean, there's always a clinical arm. And I would say all of the places that we provide services, right, such as, I don't like to give free advertisement, right, but there's a training and engagement in terms of referrals at Renfrew, because that's one of the biggest ones, Veritas. I mean, there's a lot of places that will provide information about how to get mentorship or speakers or whatever you need. And I can certainly email that to you, Claire, and you can send it on to people.
Yeah, we can certainly share that list of resources. Mm-hmm. That's important. I also want to ask generally about the attitude toward mental health treatment in general. Do you see a cultural difference, even if there's a similar background in ethnicity in the providers? Is there, are there different attitudes towards mental health treatment?
Well, I think, because historically our community just really, there's not been any self-care. There's not been any, it's a stigma, right? And it's more of there can be, and I don't want to, sometimes people coping mechanisms kind of through their faith, right? And so kind of how spiritual advisors, so people, I think it's improving. I think now people are just wanting to be well and flourish. I do think people, it's not so much if I don't want to see a therapist and be well, it's I know all the history that has gone wrong with Black people, right? In terms of Tuskegee, eugenics. I mean, all of these things, people have, there's some suspicion or fear about will I be, will I be taken seriously, or am I being sort of kind of, is this something that you just want to be curious about me, but really am I? So I do think there's skepticism. I think there's some concern, but I think with competent, caring providers, that sort of, you can set that aside immediately. Hmm. So I think we don't want to, we can get into this thing about, well, do Black people really want to go see therapists if I'm not da-da-da. I think people just want to they want to be treated with respect and dignity and treated as a human. And when we do that as clinicians and providers, people will be feeling comfortable to sit down and work with you.
Mm-hmm. Yeah, I think that access to really quality care is important, and care that feels, I think when you are working with a provider, it feels nice to walk into a space where, it needs to feel safe. And so I think that the more that there's access to that, everyone responds to someone who is really there to care and with an interest in providing for each person on an individual level.
Mm. Yeah, that's a really important point. I want to ask a question about language and terminology. I think that sometimes even the terminology around eating disorders can be a barrier. And Dr. Fuller, I wonder if you can speak to this from your clinical experience, and then Karla, if you can respond from your experience too. Is there, do we need to be thinking about how we're communicating about eating disorders, and is there is there something in that the language that is a barrier?
I agree. I struggle. I know I have the luxury, I'm not an MD, so I don't have to do diagnoses for insurance and all that reimbursement. So, I think it's something about gendered women and disordered. So I tend to shy away from those sort of diagnostic DSM categories and stick with eating problems, eating challenges, and eating issues. Because I think there's, this is I think when you're talking about advocacy and activism in a way that's empowering to women, that, 90% of women are really kind of, and I'm really kind of being flippant, but over 50% of women doing this work, right? we are within that patriarchal kind of thing, but so women need to support women, and I love the men, relational men, and all the men who are helping us. I don't want to do anything like that, because I'm hoping we have participants in the audience that are males. But I do think that there is a large number of women doing this work, because I go to conferences every year. And I go to conference between 125 to 700 individuals, that participants or that are at these conferences, and it's a large percentage of women. So I do think that all of us, everyone, all inclusive, we need to be able to talk about what type of language and how we want that. And so it's not just some of us trying to say, is it eating problems? Is it disorders? I think that we need to open up, just like access and all of this. We need to think about what we're saying. And you know, we talk about eating disorders, but we can talk about marginalization. We could talk about privilege. You know, all these things are triggering for certain people. For certain people, they are not. And for some people, they are. So we just need to be mindful of that.
Yeah, I mean, I think it's so interesting, and it's important that we're talking about language. And I think also in language as far as being receiving treatment as well, you know, being able to feel like you can speak clearly, and again, having a practitioner who's aware that their language could be triggering, having a relationship with your practitioner where you feel comfortable to say, that doesn't work for me, or, you know, I think speaking aloud what we're feeling is so often a barrier. It's like why I didn't want to receive recovery at first was just because it's such a secretive part of my life. So to feel safe enough to speak is really important, and a lot of the language that's used, and also being able to just speak freely, to not have it be measured in any way. I think that if we have practitioners who can speak to people on the level, on like a human to human level, then that opens up the space for the person receiving treatment also to respond from their truth.
Yeah, thank you for that, Karla.
Mm-hmm.
We have about 10 more minutes. Are there, I just wanted to check in with Kirsten. Are there questions that are coming from the audience that we need to address?
We got all the questions that came from the audience, and I sent you the some other topical things that we wanted to possibly discuss as well in your chat.
Okay. I'm just looking. Okay. I think we got to all of those. Well, maybe I think it would be helpful, you know, certainly to talk about. I know, Dr. Fuller, you listed some great resources, and we'll be sure to follow up with those.
Okay.
Karla, is there anything you know, from your end as someone who has had the personal experience of an eating disorder in recovery, were there resources that were particularly helpful to you, or you know, other ambassadors or influencers who made a difference in your recovery that you'd want to share with this group?
I mean, I'm really excited for Dr. Fuller's book.
Yeah,
personally.
I am too.
Thank you.
It's awesome, and I think that for me, because I needed it so badly, I found my own way, and I hung in there because I was desperate. But I think that I'm just excited that the conversation is being expanded to Black women and women of color, because it's, as I shared, my mom has struggled for years, and I think that the biggest barrier to her receiving recovery, aside from her own personal stuff, is not feeling comfortable in a room, not feeling like, feeling embarrassment, and feeling like she's not able to just be herself, or that there's some other kind of judgment from her white counterparts, whether that's true or not. But even to be in a space of understanding that is entering the room with her, to have a practitioner that understands that, I think would be incredibly helpful and add to healing for many, many people.
Thank you for sharing that. Yes, certainly I think that one of the biggest things we need to, there's so much here, but, clearly the need for, for education and training of clinicians is critical. And for those organizations that are really focused on that, and, certainly from NIDA's perspective, just doing the work and the, awareness and help seeking and connecting people to help, to be able to know that there are providers who really do have that expertise and compassion, and, again, that everyone deserves recovery, and to get that message out there, and to be able, again, to connect people to resources, quality, as you said. I think that's so important, quality treatment and resources that reflect their experience. Dr. Fuller, we're getting ready to wrap up. I'd love to just give both of you an opportunity to share any last thoughts or parting words for the group, and then I'll share a few resources from NIDA's end for the audience. But did you have anything else or just as a closing?
I just want to, again, extend gratitude for all of us, including the participants and the panelists, and NIDA leadership and administration for placing value on this most important issue with Black women and eating challenges, I would say. So I'm happy to be a part of this, and I will extend, it's easy to just Google me up or find me. If anyone has questions that they want to ask me, I'm available and happy to, support someone's journey or any questions they might want to ask. And again, thank you very much.
Thank you. Karla, anything you wanted to add? I know, you've been so courageous in sharing so much of your own journey. Anything that you want to leave this audience with as we close out the session? Similar. Gratitude. Thank you for inviting me and including me into this conversation of really astute and incredible people in the field. Thank you for doing the work and being interested in helping people like me. And one thing that we talked a lot about, and that has come up a little bit on the call today, but that I just want to reiterate, is the idea of accountability. And, really using each other as resources, that there are people who are doing this work. Obviously, Dr. Fuller is extremely accomplished, has been doing this for many years, has the vocabulary. So to not be afraid to reach out to the people who are doing the work to learn, to not be afraid to say, I don't know in this area, and seek training so that we can become experts. Thank you. Yeah, I think humility and willingness to learn are really, really key. And I want to thank both of you, Dr. Fuller and Karla, again. So wonderful to have this discussion and this opportunity. We're, of course, just scratching the surface here. There's so much more to explore, and certainly looking forward to further conversation with both of you and expanding this and continuing this really, really important work. I also want to thank again Kirsten and Eating Disorders Hope for and the whole team for putting together the conference and giving a platform for this discussion, which is so important to Nita and all of our colleagues here. Just, you know, for those of you who are watching who might know someone, or if you yourself need help or additional support, the National Eating Disorders Association is here. You can visit nationaleatingdisorders.org and also contact us by phone. Our helpline is open, and we have trained volunteers who can connect you to support and expert resources in your area. That number is 800-931-2237. And also because we talked a lot about advocacy and activism and how important that is in eating disorders work, I do want to encourage if everyone can share one thing on social media and get involved. We are just about to kick off our National Eating Disorders Awareness Week campaign planning. This year, we're really going to be focusing on busting myths and talking about the importance of recovery for everyone, and of course, always connecting people to help and support. That's front and center in Nita's mission. So thank you again for all of you who have taken the time to listen in. We will certainly follow up with resources. Dr. Fuller, we're going to be contacting you about that book. Super excited.
Thank you.
So we'll be sharing that soon. And again, thank you everyone for joining today.
Right. Have a wonderful day.
Thanks. Take care.
Thank you.
Bye-bye.
Thank you all so much. Thank you, Claire, Karla, and Dr. Fuller.